role at the college is as professional lead for infection prevention and control. Excuse me, I'm a bit croaky. Alongside that, I'm also the nursing sustainability lead, and infection prevention and control and sustainability fit really nicely together. And through our work on procurement, that's how I've developed an interest and taken on this portfolio as well. So what I'm going to do, excuse me, I've actually got two presentations to give to you today. The first is a very broad introductory presentation on planetary health to really set the scene for sustainability, which will follow. Now, these are huge topics. We could be here for weeks talking about these, as you could IPC. But I'm going to give you a broad overview. And what I want to do is introduce you to some new language and some things, particularly when we get to sustainability, for you to think about potentially for your service improvement project. If you are interested in sustainability and if it is appropriate for you where you work, to consider this at the moment. So Pablo is going to share, excuse me, the slides. I'm just going to take my camera off to make sure I stick to my notes for you. When you're ready, Pablo, do you want to share the first slide? There we go. Brilliant. Thank you. So this first presentation, oh, sorry, could we go back one? Is going to introduce you to Planetary Health. And the Royal College of Nursing is a member of an organisation called the Planetary Health Alliance. And this presentation is adapted from a publicly available slide set from them, but amended. So it's specific really to help you and be relevant to today. I have put this together so that sustainability can follow. And obviously there's an emphasis on infection prevention and control. But what I'd like you to do, because when we think about planetary health and when we think about climate change and its implications, it has both personal and professional aspects to it. But for today, I'd like you to think about what it means to nurse the planet. Next slide, please. So here in the United Kingdom, we are incredibly privileged to have resources and live in a large degree of safety that many in the rest of the world don't have. But when it comes to climate change, we are as vulnerable as any other country in view of the effects that it may bring. And the image on the right-hand side is from the UKHSA, and it represents something called the Adaptation Assessment and Report, looking at the United Kingdom and where our vulnerabilities lie in relation to climate change. The effects of a warming planet will be felt in different ways. There is no linear rise in temperature that we will all see an increase of 1 degree, for example, at the same time. So the effects of a warming planet and the effect on our ecosystems will vary based on geographical and socio-democratic differences. So you will see different effects at different parts of the UK. The evidence on climate change is evolving, but now we have actually got, through publications such as the Lancet Countdown Report and other big global reports, emerging evidence on the impacts of a warming planet on health. And most of the evidence actually sits with the impact of extremes of heat and cold. We know as well that there's going to be a significant impact in terms of flooding, and flooding just doesn't just cause economic impacts, but it has a real effect on the physical and mental health of individuals and communities. So for community nurses, for example, who need to travel, or for those that work in particular flood-prone areas or at sea level, this is going to become an increasing area that we're going to have to consider in terms of nursing practice. There's been a lot written around the expected increase and the predictions around vector-borne diseases. And in fact, there's a lot in the news at the moment around Congo Crimea hemorrhagic fevers in Spain, and also dengue and other vector-borne diseases in Europe. And we are expecting these to increase significantly. Something that's not often considered when it comes to thinking about our vulnerability to the effects of climate change is actually food security. And it's important to remember that what happens in the rest of the world is really important for what happens to us here in the United Kingdom, because many of our supply chains for food and other items, including consumables and supplies that we use to deliver health and care, will be at major risk. So there's going to be volatility in supply chains moving forward, as well as the well-known effects such as wildfires and droughts. So how do we start to think about this now in relation to our practice, and what does it mean today? Next slide, please. So there are two keywords that I'd like to introduce you to now. The first is mitigation and the second is adaptation. A lot of the work to date has focused on mitigation, and that is essentially taking action to reduce the release of greenhouse gases that can cause rises in temperature. So we're mitigating the effect. We want to try and avoid warming temperatures. But the temperatures are rising faster than predicted, and therefore we also now equally need to consider adaptation. And this particularly relates to where we will provide health and the status of our health and care services, and where we deliver healthcare, such as hospitals. It's really important that our health and care services are able to meet the demands for health and care in the future, not just now, but also that our buildings are resilient to cope with the changes that are expected to occur. So mitigation and adaptation are two key words for you to listen out for. Next slide, please. So if we get back to planetary health in terms of setting the scene for things that we are going to do to improve planetary health and try and reduce the worst of the effects of climate change. This is a new and evolving area of science, and it is based in science. And it's very much a solutions orientated field, and it's based on collaboration and multi-professional or transdisciplinary working, but it's also a social movement. And it's really about everybody coming together and working together to address the impacts on the Earth systems of our human activity. So it's a scientific field and a global movement, and it's one that's becoming increasingly talked about as people become more aware of it. Next slide, please. So how does it all fit together? Because I've just introduced another piece of language. You will be familiar with public health. You will undoubtedly heard of global health, and in particular One Health in relation to antimicrobial resistance and the need to think outside the boundaries of human health to consider, for example, animal health and environmental health. Planetary health can be thought of as an overarching umbrella that encompasses all of these, but is particularly focused on the environment and the relationship between our health and the health of the environment that we live in. Next slide, please. So planetary health is the overarching umbrella, but in describing why we need to do this and how we are going to work to improve planetary health, there's a few more sort of new language pieces to introduce you to, and I'll come on to these in the next few slides. Next slide, please. First of all, it's really important that we acknowledge and remember that human beings, or humanity, has actually made huge public health gains over the centuries as we have evolved as a race or as a species. So there's been tremendous public health gains by addressing some of the fundamentals associated with, for example, childhood mortality and life expectancy. And these have come about through better food and diet, through evidence around science, through improvements in hygiene, and the introduction of health and care and medicine. So as humans, actually, we have done significant good, but at the same time, there has been an effect. Next slide, please. So in becoming more prosperous, in becoming healthier and addressing some of the huge public health challenges over the centuries, we have actually disrupted some of the Earth's natural systems. Now, whether people were aware of this when we started becoming more industrialized or not is for debate another time. But what we know now, and we can only deal with now, is that we have produced what's called anthropogenic environmental change. And anthropogenic changes, very simply put, are changes caused or influenced by people, that's us, either directly or indirectly. So this is not about blame. It's about acknowledging where we as a race, as humans, have had an impact on the planet. And you will often see written, if you read some of the evidence and literature on climate change, reference to us now living in what's called the Anthropocene. So that's that period of time where we are living through the effects on our planet of human activity. Next slide, please. So very simply, and this is really just one of the key messages I want you to take away today, is this for me is simply about cause and effect. It's the price of progress and the impact that it has. So what we now need to do is to redress some of this impact and be more mindful now and in the future of how what we do has an impact on the planet that therefore impacts on us. So as you can see from the graph on the left, that represents what we call socioeconomic trends. So this is what we have done to become more productive and more wealthy in our eyes. And on the right-hand side are represented the Earth system trends. So this is the effect on the planet. So you'll see there some examples of significant increases in human population. As we have become more numerous, more of us have moved into cities, so urban population has increased in order to ensure we have enough water supply. We have introduced larger and more dams. To get around, there's more transportation, we use more energy, we use more water to feed ourselves, we use more artificial fertilizers and have cut down forests to make way for both agriculture and use of resources. On the other side, on the Earth system trends, this has had an effect. So the increase in emissions of carbon, of greenhouse gases, of which carbon dioxide is one, methane is another, nitrous oxide is another, for example. You can see that these have risen in a similar way. The surface temperature of the Earth and the oceans has increased as global temperatures have increased, but also there's been an impact on ocean acidification, loss of tropical forests, and an increase in domesticated land use. So this is very simply cause and effect. And this graph is often referred to as the Great Acceleration. Next slide, please. If we go into a little bit of more detail, just very quickly, you can see how some of the graphs here show really nicely how the growth in population relates to growth in gross domestic product, or GDP, which is how we measure wealth. So there is a core relationship between the two. Next slide, please. Likewise, in a little bit more detail, some of the graphs on the right-hand side that I showed you there around tropical forest loss, ocean acidification, increases in atmospheric carbon dioxide, and also things like marine fish capture. So that's fishing, for example. Next slide, please. So from a planetary health perspective, and the Rockefeller Foundation and the Lancet Commission are working together globally to increase awareness about this. Simply put, we have mortgaged the health of future generations to realise economic and developmental gains for the present. Interestingly, because we work with, from a planetary health perspective, with nurses internationally across the globe, this has been the need. Sorry, can you go back, Pablo? The need to always consider future generations is something that's been embedded in First Nations ways of living and sort of mindfulness for a very long time. And they refer to something called the 7 generations. And I really like this because that's about thinking about what we do now today, and to consider that the impact that it may have in 7 generations' time. So Indigenous people, First Nations people have always been very mindful of the connection of how they live with the environment and what it means for the future. So that's something that you might want to take away just to help you think about things in a different way. Next slide, please. So our environment is changing. It's not just our climate. And there is lots of data around how the climate is having an effect on our environment. And it's through all the things that I have mentioned previously. Next slide, please. These changes, yeah, you can go to the next slide, Pablo, will have a significant effect on our health, but also the health of other life on the planet. For us as humans, this does mean that potentially we could undo some of the public health gains that we've been so good at making up until now. Now, due to the physical effects of a warming planet through things such as air pollution, anxiety, mental health, and migration, and all the other effects that we're seeing now, the health impacts are starting to emerge and become really clear. So cardiovascular disease, respiratory diseases, and for us in working in infection prevention and control, antimicrobial resistance, and not only its emergence, but more resistance becoming widespread, is a very real risk. So there's a lot to consider, and not all of these will impact in the UK, but many will in different ways. Next slide, please. So planetary health is a science, as I said before, and the key take-home message from this slide, and one that we'll talk about when we come to sustainability in a minute, is that this is about a systems approach to solving some of these problems. So it's about the bigger picture and being mindful of how all the dots connect so that we as nurses can think about how things are interconnected, and then where and how and if we are best placed to make changes. So we have to consider some of the underlying factors, the drivers, the causes, the health effects, and then what we can do about these. Now, it's not the job of nurses to solve every problem that the planet has, but we are the ones, because of our close connection with communities and our care for individuals, that has sight of the bigger picture and are best placed to think about what we can do in our roles, even in very small ways, to affect or influence change. Next slide, please. So Planetary Health maintains a sharp focus on human health, which is what we are here to deliver, whilst recognising that we don't live in a bubble, and actually we share this planet with other natural systems that we need to consider. But so by taking action from a sustainability perspective, that is our contribution to planetary health. Next slide. So what makes planetary health so unique and adaptable? Well, given its global reach and given that we are all networking and collaborating and sharing what's working for us so others can take what's relevant to them and use it. What's really good is that everyone is clear and behind the urgency of where we are now and the scale of which we have to work. So this is about not just identifying problems, but also seeking solutions and learning when things perhaps don't work. Taking a scientific approach, building the evidence base, even in a simple way, that's not necessarily a randomized control trial at all, but taking a scientific approach, building the evidence base, and doing that in a multidisciplinary way will have a much better effect than countries trying to do this individually and remaining in silos. Next slide, please. So in order to achieve planetary health, we've looked at and understand the great acceleration, the cause and effect. What we need to do now is to put in place what's called a great transition, where we start to think and act and learn as we begin to do things differently. So we need to consider things such as how we produce and consume food, what consumables we use, how these are made and transported, how energy is used, how we might live differently in the near and far future, and how we manage that relationship with the environment, which is so important for our health. Next slide, please. What we know is that this great transition will need us to innovate, but it also needs us to collaborate. So the key take-home message from this slide, which I'd like you to think about when we talk about sustainability, is how we work with other areas, other industries, and how we can collaborate to influence. This is about everyone coming together. And one of the big frustrations for me in my role when I go to meetings, say around antimicrobial resistance, or I'll go to a meeting on climate change, is often that the financial or economic aspects aren't linked up to the health aspects, that aren't linked up to the innovation teams, and aren't linked up to education. So this is about us as nurses trying to encourage collaboration as far as possible where we think that relationship exists and where others can actually help us achieve what we want to achieve. What is good is that the 5-year AMR strategy, which I'm pretty sure Chris has talked to you about today, does talk about climate change and does acknowledge the relationship between a warming planet and climate change, and the need to consider this with antimicrobial resistance. So that's a good start. Next slide, please. So how does infection prevention and control activity, or the prevention of infection more widely, help as we move towards implementing a great transition? Well, the first thing for me is that we need to think and act sustainably. So you might want to consider whether there is, and it's not mandatory, but whether there is a sustainability benefit to the small service improvement change that you're thinking about doing. How we can foster collaboration, because infection prevention and control cannot be done in a silo by one person. How we will advocate and raise awareness. And importantly, how we will let people know what we have done, demonstrate our impact, which you'll have sessions on, and how we will help to educate others. Next slide, please. So this is just a closing slide here from one of the chiefs in the First Nations around humankind and how we connect to the thread of life. So that's going back to the Indigenous roots. Next slide, please. So this is a pause slide before I come on to talk about sustainability. And I just wanted to ask if anyone has any immediate questions or comments in relation to that very brief overview. And I do apologise for it being a bit brief before we move on to sustainability. Chris, I can't see if there's any hands up or any questions, sorry.
No, I've checked the chat. There's nothing in there at the moment, and I'm not seeing any hands up.
Okay, so we've set the scene for planetary health. And now we're going to come on and just narrow it down a little bit more to sustainability, what it means, and how we can think about it in terms of infection control. And again, this is a very brief introduction, but I hope you find it useful. So Pablo, could you move on to the next slide, please? So a very quick introduction to sustainability in about 20 minutes. No, it'll probably be less, because otherwise I'll get told off for being late. So
you've got enough time, Rose. It's up to you.
Okay, all right. So next slide, please. So what we're going to look at in the next few slides is what is sustainability, because it is the new buzzword and not everybody understands what it is or what it might means. We're going to focus in on what it means in the context of health and social care. And then we're going to look at some of the big drivers and actions that are going on, and then look at infection prevention and control. So next slide, please. So sustainability, the language of sustainability is really where procurement was about 10 years ago when we started talking to nurses about procurement. It was new language. It was something they thought somebody else did. We talked about consumables and supplies, and there was all sorts of different thoughts and thinking about what the nurse's role was and why we needed to know about procurement. Sustainability is in a similar place now. What I'd like you to do is think about sustainability as 3 interconnected circles. Now, you may see these referred to using different language, such as people, planet, profit, the 3 Ps. But I've described them here as environment, society, and economy. Now, we've talked about the environment a little bit already in terms of planetary health. But the key take-home message for this slide is that all three are equally important. So we cannot just talk about the environment or consider the environment without taking into account the impact on local communities or societies from a much broader perspective, or the economic principles. So, for example, if we were to just consider economic growth without considering the impact on the environment or society, then whatever it was that we were introducing would not be sustainable. Likewise with the environment, if we were only to plant trees across the planet and not consider the economic impact and the societal impact, then that action would not be sustainable. So sustainability is a balance between all three, and it allows us to think more broadly about the effect of what it is we are doing or buying or procuring or whatever it is. So it's about balance, and it's about the appropriate use of natural resources by us as humans. And if we get sustainability right, then it is much better for the future and future generations. Next slide, please. And this is very much the ethos and the theme behind the United Nations Sustainable Development Goals, which some of you may have heard of. And achieving the Sustainable Development Goals to enable future generations to thrive, as everybody has a right to, is core to all of our economic health and benefits. And there is a specific Sustainable Development Goal on climate action down there, number 13 at the bottom. There is no Sustainable Development Goal for infection prevention and control or antimicrobial resistance, but there is a thread that for these that goes through many of the Sustainable Development Goals. Next slide, please. So why is health and social care important when it comes to sustainability and action to mitigate climate change? Well, there are, like there are in infection prevention and control, many legal and regulatory requirements. So here in the UK, we have the Climate Change Act 2008, which has in place legally binding targets for the United Kingdom to achieve net zero by 2050. Now that is having an impact on the NHS in particular, acknowledging that we provide health and care outside of the NHS, and also there is adult social care. Because under the newly revised Health and Social Care Act, the NHS is legally bound to meet its net zero targets, and it has set targets to achieve these. So this is enshrined in law. So if it's enshrined in law and you work in the NHS, that's important for your ICB, it's important for your trust, it's important for your chief executive. It's a must do. In order to achieve net zero in the NHS, it's been included in the NHS standard contract, which every organisation has to sign up to. And from a regulatory perspective, in England, sustainability is now included as part of the single assessment framework. Now, all 4 countries of the UK have strategies in place from a sustainability perspective and are working towards net zero for their respective NHS and adult social care provision. Those are just some examples from England. Next slide, please. So the size of the problem, actually why healthcare is important, is we produce up to about 5% of all UK emissions. If you look at this globally, if healthcare was a country, we would be the 5th largest country on the planet because of the amount of emissions we produce. And this is important because we use so many consumables, we buy and manufacture so much equipment, We have so many medicines that we use, and we transport a huge number of people and staff. So all of these contribute to the production of greenhouse gases. If net zero targets are to be met, we have to work with every other part of the system and think about the effect that we have where we work on this. Next slide, please. So the starting point in terms of what we know now, so the NHS, Greener NHS team has done some really good work identifying currently where we think most of our emissions come from. So that the image on the right-hand side shows that medicines, medical equipment, and other supply chain through procurement is a significant part of where our emissions come from. So that's a key target. The NHS carbon footprint relates to our buildings, our use of energy, our use of water, and our travel, for example. So that's another big area. And then there are some other smaller pieces of the pie chart there, and some are going to be easier to reduce than others, but I'm sure you'll appreciate it's a very, very complicated and complex interconnected picture. You may hear people refer to scope 1, 2, and 3 emissions. This is a way of dividing up what it is that we can influence and reduce directly and where it's going to be more difficult. So scope 1 and 2 emissions, direct and indirect emissions are ones that we can tackle ourselves. Scope 3 is going to be far more difficult. These are indirect emissions that actually we are going to have to rely and work with others, such as manufacturing, etc., to really get sustained change. Next slide, please. So if we get onto some practical examples now, could you move the slide, please, Pablo? There's what we call low-hanging fruit to help us get to net zero, and you might recognize some of these. So better waste segregation, better waste systems, increasing recycling in organizations, nursing staff in particular, because we're the biggest part of the workforce and we produce the most waste because of what we do when we are at work. Putting things in the right bag will have a significant effect in terms of greenhouse gas emissions. A lot of work has been done across the UK in all countries around looking at anaesthetic gases and the removal of desflurane, for example, which was really significant in terms of a gas that has warming potential for the planet. There's been a lot of work done, particularly around asthma inhalers, moving away from pressurized meter dose inhalers to something called dry powder inhalers. And these dry powder inhalers don't contain any propellants. So that when you consider how many we prescribe and use across the UK and internationally, can move the dial significantly. On a practical level, things that nurses are doing at the moment, they're looking at their routine use of couch roll and removing it where it's not appropriate. It's still appropriate and should still be used in some places, but we don't need it in ophthalmics, for example. We're looking at virtual consultations where these are clinically indicated and appropriate to try and reduce unnecessary travel and to make care more convenient and appropriate to individuals. We can switch to things like low energy light bulbs in our health and care buildings. We can consider reusable sharps bins where these are appropriate. We have electric ambulances, the first in the world here in the United Kingdom. But actually, even when something sounds like an easy switch or an easy change, it's not necessarily. Next slide, please. So where we can make progress, but it's challenging, even if we think it sounds easy, I've put some examples down here. Now you'll be able to think of all sorts of things where you work, where you've identified that we could work slightly differently. So reducing the number of single-use items and moving to more reusable items makes complete and utter common sense where it's appropriate, but actually it's really complex to do that. And if you think about the number of single-use items we have, it's huge. It may not actually be greener to move from single-use items to reusable items. We could look at producing single-use items differently, for example. It sounds really simple in some cases to introduce a glove reduction campaign and to talk about appropriate use of gloves, but actually this involves human behaviour, changing culture, and it's actually really quite challenging and complex to do in practice. Providing plant-based meals, standardising packs, and reducing single-use cleaning and disinfection wipes is something that we would all aspire to do, but again, will involve working with many, many others and challenging culture in practice. One of the big areas where nurses can make a difference in community and hospital settings is through antibiotic stewardship, which is part of overarching medicines optimization programs, where we look very carefully at, does the patient really need that medicine? Where are we prescribing medicines that aren't needed or the patient isn't taking? Why aren't they taking them? And looking very much at an individual level around that. You will have or have had a lot of information on specimen collection. And again, that's a really big area where nurses can have a significant effect on pathology services, the use of items and energy that all goes into specimen processing. And then the big one for me is around preventing the need for health care in the first place where we can, and then avoiding harm through patient safety. Next slide, please. But in order to do that, we need to close the knowledge doing gap, as my colleague, Dr. Brigitte Litzi says. Next slide, please, Pablo. So this is about looking at the evidence. Are you there, Pablo?
I'm going to say we seem to have lost Pablo.
We might have frozen. Oh, there we are.
There we go.
So you have a session on critical appraisal of the evidence, and this is about looking at how you implement evidence in practice. So in the same way that we do that in infection prevention and control, we need to do it with sustainability. So this knowledge doing gap is something that we need to think about, and it will be different for each of you because you all work in different areas with different groups and with different colleagues. So that's something that we can focus on. Next slide, please. From a public health perspective and from an infection prevention perspective, we really need to get our public health invested in and to operationalize this, because our health and care services are only the recipients of our public health strategies and our public health actions. And we have wide disparities, as you can see there in that example of England, where there is regional variation in the number of adults that have long-term conditions. So long-term conditions are huge, and we're really starting to become aware of some of the challenges that our health and care systems are going to face over the coming years, as you can see there in that list. When we combine that with the predicted changes in population by age over the next 30 years, we have really got to think and act very differently if we are going to have a healthcare service that actually meets the needs and expectations of our population. And all of this actually has an impact on infection prevention and control, but also if we think and act differently and focus on health interventions to improve public health, it will have a huge benefit from a sustainability and climate change perspective. So, last slide. And then if we've got time, we can have a quick chat. Some of the realities for us to acknowledge and be mindful of. So the first one for me is that sustainability is going to be something that you're going to hear an awful lot more about wherever you work in the future. It's a really important area that brings benefits to not only the quality of health and care provision, but actually improvement of health overall. Now, there is a huge amount of interest in infection prevention and control aligned to sustainability because of single-use items and all the things that I've mentioned before, but also because as people, they are really, really interested and are passionate about this. But there is unreasonable demand for infection prevention and control practitioners where resources are limited to get involved in sustainability projects. And I was talking to a colleague from Holland who said that they are inundated with requests and actually they simply don't have the capacity to do that. So we're going to need to think around where we really need to get involved, who is the right person to lead these projects, and where infection prevention and control can add value. It's not our job to deliver everything. We are not experts in life cycle assessment and doing the carbon maths. There are others out there that can do it. So it's about where you bring your particular skills to the problems and where you add value. So this is about multi-professional collaboration. I would advise you to start with something simple for your service improvement project anyway, but especially if you're considering something from a sustainability perspective, because simple is not often as easy as it might sound. But there are people out there that can help, and procurement nurses are a great starting point for advice and support. If you work in a trust, you may have one, or you may be able to access your local trust's clinical procurement specialist nurses for some advice and support. The most important thing, as I said in the lecture on planetary health, is that we need to build the evidence base and demonstrate impact. So listen carefully when you have your demonstrating value session, because Karen will help you to consider how you might do that. And that's it. I think just one more slide there, Pablo, and that's it.